Hello, and welcome to Inventors Helping Inventors. I'm your host, Alan Beckley, inventor of the Wonder Wallet. If you're an inventor searching for proven ways to make money with your invention, if you dream to see your product selling in stores everywhere, you've come to the right place. There's no better place to get help than from experts, inventors who've already achieved success. Every week, I interview successful inventors, asking them the questions you want to know. Tune in to learn from the experts so you can get your invention out of the tank and into the bank.
We are different from the current treatment options in the sense that our treatment actually addresses the root cause. It redirects the testosterone-rich blood away from the prostate and restores this imbalance of testosterone in the body, naturally reversing BPH over time. And since we are not even in the vicinity of the prostate, our technology does not touch the urethra, does not touch the prostate. There's virtually zero risk of any sexual or urinary complications.
Summertime is upon us now. As an inventor, this is a perfect time to hone your marketing message so you're ready to hit the ground running this year to approach companies with your product. Through premium coaching, I've helped quite a few inventors just like you to do just that, to create your clear, concise, and compelling marketing pitch. I'm happy to help you gain traction with your product as I have for other podcast listeners. So if you're hearing, it's not really for us, it means your marketing message is unclear to them. It's not compelling. That's why they say no. If you'd like to know more, to see if premium coaching might be a fit for you, just email me at alan@alanbeckley.com and put premium coaching in the subject line. I'll get back with you to set up a Zoom meeting. But don't wait, as I have room to take on only 2 more clients at this time. So again, just email me at alan@alanbeckley.com and put premium coaching in the subject line, and I'll get back with you to set up a Zoom meeting. Oh, quick update. 2 weeks ago, a podcast listener joined me as a new premium coaching client. This means I now have room for only 1 more client. If premium coaching seems right for you, don't wait, or someone else will get that last slot ahead of you. Just email me at alan@alanbeckley.com and put premium coaching in the subject line. I'll be happy to help you. Welcome to episode number 542. Today is a rebroadcast of one of our classic favorites, episode number 334, way back to September 4th of 2023, with successful inventor Tushar Sharma. He invented Vivify, a new minimally invasive surgical procedure to address BPH, a prostate condition millions of men suffer from. I think you're going to enjoy this episode as much as I did. Tushar Sharma was born in a small town named Mandi, nestled in the valleys of the Himalayas in India. His family moved frequently, so Tushar was able to enjoy living in a variety of places within India. He completed his undergraduate degree from the Indian Institute of Technology in Madras in biotechnology, with a minor in advanced chemistry. By the time he graduated, he was one of the few undergraduates to publish his undergraduate research in multiple international journals, represent his institute for cutting-edge research at a conference in Santa Clara, California, and has received numerous awards for his work on microbial fuel cells. He completed his master's at UT Austin in 2010 and his PhD in 2012, both in biomedical engineering. After graduating, Tushar worked at R&D division of Intel on the next generation of microprocessors. He was awarded the PTD Logic and Technology Award at Intel for his contribution on creating a new process that resulted in savings of over $50 million every year. In 2016, Tushar went back to his roots to work alongside physicians and help develop novel devices and technologies. He worked with multiple physicians to develop devices in the fields of blood coagulation assay, diabetes, pediatric surgery, stroke treatment, cardiac AFib, laparoscopic surgery, and robotic knee replacement. He has over 20 patents filed or issued. Tushar is currently the CEO and founder of Vivify Medical, a company he started in 2019 to develop technology for treatment of prostatic conditions, including BPH, or benign prostate hyperplasia. You'll want to listen to this entire interview to learn how the Vivify surgical procedure addresses the root causes of BPH and is minimally invasive compared to many current surgical treatments. Also, why most men will develop BPH as they get older, so that the Vivify procedure can provide treatment options without the painful side effects. And finally, how Tushar anticipates clinical trials may begin in 2025, with FDA approval for human use anticipated by 2027 or 2028. Now let's get right to our interview with Tushar Sharma. Tushar Sharma, it's a pleasure to have you on the podcast with us today.
The pleasure is totally mine, Alan.
Tushar, I'd like to start out by saying, could you share a bit of your background with our listeners? Where did you grow up and go to school, and what did you do before you became an inventor? Can you share that with us?
Yeah, absolutely. Happy to. I'm originally from India. I grew up in a very small town in India in the Himalayas. The population of that town is about 10,000 people. And while growing up, we lived in all different corners of India. My dad was in a transferable job, so we moved in 4 different corners. I did my undergrad in India, what is known as the MIT of India, because the acceptance rate is less than 1%. And I did my undergrad in India in the South, and before moving to the US to pursue my master's and PhD.
Thanks so much for sharing that with us. And I like the way you phrase it. It's effectively the MIT of India. And you said less than 1% get accepted. So that's pretty amazing. So that's a great background getting you started. And coming from a small town in the Himalayas, that sounds like that must have been an interesting growing up for sure.
Yeah, absolutely. It was fun. We would get to travel all the time to the Himalayas and all different places, get to eat from the fruit orchards in the Himalayas, while also getting experience in the city life where we were living at the time when we would travel back home to our hometown in the Himalayas.
Tushar, you invented the Vivify procedure that uses a medical device to reverse a condition called BPH, or benign prostate hyperplasia. And that's the second most common cause for surgical intervention for men. As you described it to me, in a healthy man, the testicles direct high testosterone enriched blood north towards the kidneys via the highway of the spermatic veins. For BPH patients, the spermatic vein highway effectively becomes congested, in a manner of speaking, causing highly enriched testosterone levels. This can be up to 100x to backflow south into the vicinity of the prostate. When this happens, the prostate becomes enlarged, causing urinary complications and sexual dysfunctions. Is that a reasonably accurate analogy for this condition, would you say?
Yeah, absolutely. Spot on, Alan. I'm thoroughly impressed that you picked up such a complicated problem in a very quick, short span of time and explanation. That's a very important, accurate analogy for the condition.
Thanks very much for the compliment. And part of it is I'd like to try to make it where our listeners can envision this in a way, in layman's terms, that makes sense to them. What I'd like to ask is, can you describe your minimally invasive Vivify surgical approach that's able to actually reverse BPH? For example, how are you able to effectively replumb the vascular system to prevent the backflow of this 100x testosterone enriched blood towards the prostate. Could you share that with us?
Yeah, absolutely. Would love to. And before going into that, maybe it's a little bit helpful for the audience to really fully paint the history of what has happened in this field, especially for patients of BPH. In the late 1800s, there was a cure for benign prostate hyperplasia, which is this one of the most common causes or common disease that happens in men as they age. It starts off with benign waking up multiple times in the night to like empty their bladder, and the condition starts to constrict the urethra, and so men cannot empty their bladder in a single go, and therefore they wake up multiple times in the night to be able to empty their bladder. And in the late 1800s, there used to be a cure for this condition. The cure was a procedure where they would remove both the testicles. It was bilateral castration. Men who had complete outlet obstruction, meaning they were not able to urinate at all, in a matter of few hours to few days, they would be able to start urinating. In a span of about 3 months or so, majority of the patients would go back to complete normal prostate physiology, meaning they could urinate as if they were 20-year-old. However, this procedure was a brutal one. There were a lot of mortalities associated with this procedure, so it was abandoned in the early 1900s. And so the only urologist to ever win a Nobel Prize in the early 1900s put out this theory that there's only two factors responsible for growth of prostatic tissue: testosterone and time. And he had proved that through bilateral castration and through other experiments on the table. And the thing that confounded mankind for over a century is in his seminal work, he also mentioned that as men age, the incidence of BPH and prostate cancer increases quite significantly. However, the systemic testosterone levels in men start to decline. And that has prevented people from coming up solutions or looking at this perspective or this approach for treatment of BPH and prostatic condition. However, about a decade or so ago, somebody said that we've been looking at the wrong place. Instead of looking at the systemic circulation, we need to be looking at the local blood supply to the prostate. And it turns out that as men age, there's a higher incidence of this backflow venous blood coming to the prostate that brings 50 to 100 times testosterone rich blood coming straight from the testicles, which is an adjacent vicinity to the prostate. And that over time leads to BPH. So by redirecting this testosterone rich blood away from the prostate, we can naturally reverse BPH. And that's effectively what our technology enables, that procedure of replumbing the pelvic floor vasculature through a small incision.
Thank you so much for sharing that with us. It gives a much clearer picture, understanding the background, and especially the 1800s cure, so to speak, of removing both testicles. Of course, that then makes the person infertile, so they could not have children thereafter. So that would be a definite downside of it. But it was a solution that was there. And I like that you highlighted that until about 10 years ago, this was being looked at in terms of the systemic flow in all areas and not really focusing on the local flow in the area of the prostate as much. And that's where the ultimate problem is, that backflow into the prostate of highly enriched testosterone that is not particularly good for the prostate. Did I get that right?
Yeah, exactly.
So I'd like to ask then, is compared to currently used surgical procedures to address BPH, how is your system less surgically invasive? And also, how is it that your Vivify procedure boasts of no sexual dysfunction or urinary complications compared to other procedures? Could you share that with us?
Yeah, I would love to. So right now to treat BPH, there's numerous treatment options for these patients. You typically start on medication, then there's minimally invasive procedures such as urolift, which staples across the prostate to open up the urethra. You can put in stent to open up the urethra. You can inject steam into the prostate to kill some of the tissue, and that opens up the urethra. And then there's more invasive procedures also, such as the TURP, equablation, and other procedures where you're resecting some tissue out of the urethra or the prostate. And the standard of care still remains to this day the TURP procedure, where through the urethral approach, urologists advance the device and start shaving urethral and prostatic tissue out. And all of the current treatment options, if you heard me closely, is focused on this constriction, the physical constriction of the urethra. And they're trying to mechanically or using energy create this opening or almost tunneling out a hole through the urethra so that men can empty their bladder. Now, since they're all focusing on just the symptomatic treatment, they end up in severe side effects. So there's sexual dysfunction such as ejaculatory or erectile dysfunction, urinary complications such as blood, pain, burning sensation while urinating. Patients can typically walk out of the OR with a post-op catheter, which is uncomfortable and painful. These catheters can also lead to urinary tract infections and so on and so forth. Also, since none of them are actually treating the root cause, there's a recurrence rate associated with these procedures as well. The symptoms come back quite faster than the reintervention rates, but for some fraction of the patients that have undergone these surgical treatments, the symptoms will be severe enough that they would want to go for another treatment within 5 to 10 years of getting the first treatment procedure. We are different from the current treatment options in the sense that our treatment actually addresses the root cause. It redirects this testosterone-rich blood away from the prostate and restores this imbalance of testosterone in the body, naturally reversing BPH over time. And since we are not even in the vicinity of the prostate, our technology does not touch the urethra, does not touch the prostate. There's virtually zero risk of any sexual or urinary complications. In fact, our procedure leads to increase of systemic testosterone levels in these men. So our treatment option is wildly different than what the current treatment options offer. Imagine this, a patient of BPH coming into the OR walks away getting our treatment the same way they came in, meaning there is no catheter in the urethra. There is no pain or burning sensation while urinate post operation. There is either very low recurrence or no recurrence because we are treating the root cause. And magically over time, the symptoms will tend to improve. And that's the value proposition our treatment option offers these patients.
As I was listening to you describe that, it was pretty clear to me, and I think to our listeners, the commonly addressed surgical procedures don't really address the problem. They address the end result, the constriction of the urethra. So they're trying to get a bigger tunnel, so to speak, by removing some of that material or perhaps prostate material, but it's not addressing the root cause in any way. And in fact, there's a good chance that a number of years later, they're going to have to come back and have the exact same procedure done again. There can be severe side effects. And you mentioned post-op catheters, other things that are uncomfortable. And again, that the symptoms then later can come back. Whereas your approach is really towards solving the problem through the form of redirecting that testosterone-rich blood away from the prostate. And because of this, since the prostate is not in any way affected or touched really within the surgery, then those sexual dysfunction side effects and other kinds of issues these other procedures have are not part of yours. And then the extra bonus is because yours is minimally invasive, the patient can walk out the same day. So if I understand it, that's a clear comparison between the one and the other.
Yeah, absolutely. And I would add on to that is the medication route right now, which is usually the current first line of therapy for these patients with BPH. And they can be on medication for months, if not for years. And majority of these patients want to avoid getting surgery and go off of medication because they want to avoid all of the side effects and complications associated with the current surgical treatment options. But now there is a growing awareness within the urology community that the longer you're on medication, in addition to the side effects that they might have on medication, it can also irreversibly damage your bladder muscles. Meaning, after being on medication for a while, it might come to a point of no return, and it might be beneficial for these patients to get a surgical intervention done before that stage happens.
Next question really is forward looking, and that is, how is your current testing of Vivify going, and how long do you anticipate before you might achieve FDA approval for use on human patients? What does that roadmap, so to speak, look like for Vivify?
We have been developing our technology over here in Houston, Texas, and recently we demonstrated our procedure in dogs, and dogs have are the closest animal model to human prostate in the sense they exhibit spontaneous BPH. And we will continue with the development of technology, anticipating our FDA clearance for the technology to start doing our clinical trial somewhere in 2025. And once we have that FDA clearance to do the clinical trials, we anticipate running clinical trials for a couple of more years. So we are really looking at the product launch in the year of 2027 to 2028.
Thanks for clarifying that. And just to put it in perspective for listeners that may not be aware, because I've had people talk about the development of what they call a new molecule from a pharmaceutical perspective, is often being a 13-year process and very high risk. So really, clinical trials starting in 2025, projected to be 2027, 2028. That's actually moving along pretty quickly medically compared to a lot of other things out there. Would you say that's true?
Absolutely, yes. So you're spot on about the amount of time it takes to go through the FDA approval, and right for the right reasons, right? We want to make sure that this technology is safe, it is effective, and it does what we anticipated doing. And that's precisely why we want to take our time as well to get there. But compared to some of the other technologies and compared to how long it takes for some of the drugs and the molecules to get out for human case use, this is a relatively shorter timeline.
Tushar, as we roll towards a close, are there any parting words you'd like to leave us with?
Yeah, absolutely, Aaron. So BPH is such a ubiquitous condition. It's one of those conditions where virtually every man is going to get it. It's not a matter of if, but just a matter of when. And we believe that we are making great progress, rapidly working on our technology to get to the finish line, to deliver this technology and deliver this procedure for the millions of patients affected by this condition. And we would love for all the listeners to be part of our journey. And we actually have a survey going on. If you are a patient of BPH and are considering treatment options available out there, and would like to provide us a completely anonymous feedback on whether this is a procedure and treatment you would like to go for, or this is something attractive to you, please visit our website and reach out to us. And we would love to have you as part of our survey.
That's fantastic. And really, my last question then is, how can our listeners reach you if they have other questions? So I guess it'd be good to know your website and how they could reach out to you about the survey.
Yeah, great question. So our website is biomedical.com. It's BIVIFI medical.com. And you can also reach out to us on our email at info@vivifymedical.com. Or we are also pretty active on LinkedIn, where we continuously post about our latest accomplishments or achievements as we move along through this journey.
Fantastic. So again, just to reiterate what you just said, but basically website is Vivify, spelled Vivifi medical.com. And then they can reach you via email at info@vivifymedical.com. Just want to take a couple of minutes and really thank you, Tushar, for spending time with us to share your journey with us and really the exciting development of something a surgical procedure that's going to be a great relief to millions of men. And especially as you described it, the truth of the matter is virtually every man is going to experience BPH at some point during their lifetime. So creating a better alternative when it comes to addressing this problem is something I think that's very exciting. It'll be fun to watch the journey as it rolls towards commercial usage in 2027 and 2028. So just want to thank you so much for being on the podcast with us, and maybe we'll touch bases in another 6 months or a year and see how things are going then.
Thank you so much, Alan. That's what drives us on a regular basis and a daily basis. And we love doing this. And once again, thanks so much for the opportunity to talk about what we're working on and connect with your audience.
You bet. I want to take just a couple of moments to do something I don't do often enough, and that is to give you a huge thanks for being a loyal listener to the Inventors Helping Inventors podcast. If you've listened to 2 episodes, or 200, or 400, or anywhere in between, you are a loyal listener, and I appreciate every single one of you. This particular week is very important and meaningful to me. Why? Because on January 14th and 2019, I started this podcast 6 years ago. And I have to tell you, when I first started this podcast, I didn't know if I could find 50 inventors I could interview for the podcast, much less over 300 that I found and more coming to me every day. It's absolutely amazing, and I just love this journey. Without you and podcast listeners all over the world, this podcast would certainly not be going. So once again, I want to thank you. I'm so excited to now have gone on for 6 years with this podcast. My goal is to help you and inventors all over the world by bringing you interesting guests with interesting inventions and cool products, and to share their life stories, their challenges, and their aha moments with you. I hope this will help you as you go through the challenges with your own invention. Now, I'd like to finish with a small favor, and that is, if you could take just a couple of moments and give me not only a rating, preferably 5 stars, but also a review on either Apple Podcasts, Spotify, or wherever you listen, that would be amazing. It helps the podcast more than you might know to keep going and to draw other listeners just like you. And sometimes inventors tell me, well, I don't listen to podcasts, so where do I find it? If they tell you that, here's what you tell them. They can always find the podcast on www.alanbeckley.com/podcast. They can find every episode there. So thank you again for being a loyal listener, and more is coming in 2025. Thanks so much for tuning in to Inventors Helping Inventors. If you like the show, please tell your friends about it. Make sure to subscribe in iTunes or wherever you get your podcasts so you won't miss a single episode. Talk to you soon.